Hello, everybody. Welcome back. Nice to have you joining us, and nice to welcome our special guest, Dr. Boris Gilyadov, who's board certified in both family medicine and sleep medicine and works for our sleep program here. We are delighted to have you with us.
Thank you very much, Dr. Weissman. I appreciate being here. It's a pleasure to be here.
I mean, we're going to learn so much about sleep today, or really maybe the problems with sleep. I'm trying to think, when people have what kind of symptoms should bring people to a sleep doctor or should make people think that, maybe this is sleep apnea, maybe I should come and get evaluated?
Sure. So things that people need to take into consideration when they're concerned about a sleep disorder include things that disrupt your sleep and things that affect your wakefulness or the quality of your day in regards to feeling awake or wakeful. Those symptoms include fragmented sleep, waking up a lot because of going to the bathroom frequently, being awoken due to frequent limb movements, having snoring, waking up with a dry mouth, a sore throat, or a headache, and then through the course of the day, feeling sleepy, feeling unrefreshed from your sleep, or having a concern for being very drowsy during work.
Right, like people falling asleep in the middle of meetings or something.
Correct. In addition to that, if a patient has a history of heart arrhythmia, hypertension, obesity, concern for anxiety or depression or fibromyalgia, those are all conditions that can be associated with a sleep disorder, such as obstructive sleep apnea.
Interesting. So, that sounds like lots of things that could bring people to a sleep doctor. I think one of the things that my patients tell me sometimes is that they live by themselves, and so they don't even know if they snore, if they stop breathing. I mean, what do you recommend for them? Is there like an app or something that they can use to assess that?
If you live alone and you don't have a bed partner to give you that history or that insight, there are apps that are available that can record whether you're snoring or not. And they can help supplement the history. Something like SnoreLab, for example, you can download and leave on and it'll record potential snoring. Now, these apps are not able to diagnose a medical disorder, and they're not FDA cleared to evaluate for obstructive sleep apnea, but they can help supplement the history if needed if you live alone.
Right. Oh, that's so interesting. All right. So the real way to diagnose this, I guess, is to get a sleep study, right? And so, historically, we did these like in-lab sleep studies where you'd have to spend the whole night in the hospital hooked up to all kinds of wires. And I think a lot of my patients did it, but they didn't always love it. And now there are all these home sleep studies that it feels like it's much easier and cheaper to be able to do. Can you take me through the process? How do you decide who's better for this or that? And what's the process like when somebody signs up for one of these?
Absolutely. So first of all, if you take into account your symptoms and your medical history and how you're feeling during the day, and you go to a sleep medicine physician who is board certified in sleep medicine and get evaluated, there can be a decision that's made between a portable sleep study or a nocturnal polysomnogram or an in-lab sleep study. And that really depends on what else is going on. Are you having snoring and you wake up feeling with a dry mouth and you're sleepy? Or is there more to what's going on in terms of frequent limb movements that wake you up, dream enactment activity, concern for injuries in bed due to dream enactment or something like that, and medical issues that can affect your sleep as well as medications such as heart failure or medications that can slow down breathing. So if there's concern for obstructive sleep apnea specifically, you can go for potentially a portable sleep study like the WatchPat. If there's a concern for a sleep-related movement disorder, dream enactment activity, or those other additional medical issues that a sleep physician can find appropriate to test for with an in-lab sleep study.
Great. And the home sleep studies are things that I can order, right?
You can, yes.
And I think you have one with us to demonstrate. Take me through what happens. So I order a home sleep study. We have an office that helps make sure the insurance is okay and everything. And then what happens?
Sure. So when you order a WatchPat sleep study at Mount Sinai, we have a team dedicated to going through that process and then contacting the patient to schedule a time to pick up the test and register the test and provide them with a PIN number that they use then through an app on the phone they download to be able to run the WatchPat test. I have a demo kit if you'd like.
Yeah, I want to see that.
So it's very simple. It's light and very easy to operate. It requires the use of a smartphone and the PIN number that you get from the staff when you take the test. So you download the app, and then as you're running through the steps, you put on the WatchPat sleep study. So first you have the PAT portion of the test, the peripheral arterial tonometry, which looks like a pulse oximeter. And then you have what looks like the smartwatch. And you have a little sensor here that you tape on with skin tape to your just below your sternal notch.
Okay.
And it helps to record snoring.
Okay.
All right.
So that's doing snoring. That's doing pulse oximetry.
Pulse oximetry and
heart rate.
Heart rate and peripheral arterial tone. With increase in your sympathetic tone, you get, that happens with a sleep apnea episode. You might have vasoconstriction of your blood vessels, and that's the science behind how you develop this type of test. And it screens for sleep apnea episodes. So I can put this on.
Yeah, let me see. And then the watch thing, does that record anything, or that's just sort of synthesizing all the information from everything else?
Yeah, it also records, it's like an actigraph, so it records movement in your sleep as well.
Got it.
Right. So I would first put on the pulse oximeter or the PAT. Then you have...
This is a two-person job. I'm happy to help you here.
Shouldn't be a two-person job. Then you have it go through here like this, not too loose and not too tight. So something like this. Like this.
Okay.
And then you basically would add with skin tape right here the sensor, which you can put through your undershirt. And when you do this, there are about 6 steps that the application will walk you through on the smartphone. That'll help with each step. And then once you turn this on and you put the PIN number in, it's going to say start recording. You go to sleep. After you wake up in the morning, you click stop recording. It downloads all the data, puts it through to the cloud. That's available then for interpretation. And then you can dispose of this particular test, which is a disposable test.
Got it.
WatchPat 1.
Fascinating. Right. And you did an admirable job of that. I'm sure there are videos online and other ways for people to... There
are videos. Itamar, the company that produces this test, actually has a video online, which you could look up for the WatchPat 1.
Got it. And what about people who don't have insurance? Can they buy this online, or what do you recommend for people where it's hard to make this happen?
Right. So there are, this test is not available for purchase without a prescription.
Okay.
You need to be able to do that. Get a prescription. But if there's any concern about financial, we have a department that's focused on financial services and a dedicated team for that. So you can contact them through the Mount Sinai website and the phone numbers that are available for that kind of discussion. There are devices that are sold aftermarket that are sold on different retail websites that can help record snoring, that can help record potentially movement, but they're not FDA approved as diagnostic tests.
Got it.
Yeah.
All right. So we talked about, so when you as a sleep physician get the data from this, I mean, I'm sure there are a million things that you're looking at, but can you just take me through a little bit? What are sort of the highlights of what flags for you that somebody's got a sleep disorder or particularly sleep apnea?
So this test gives us information that correlates with potential obstructive sleep apnea. If there is oxygen desaturation, it also shows us snoring, the intensity of the snoring. It approximates sleep stages, so REM and non-REM sleep stages, sleep time, total sleep time. And it'll give you a sense of potential sleep apnea episode as well as central sleep apnea episode, different type of sleep disorder breathing. Those are the things that we look for on the WatchPat test. And then we look at criteria that help us to determine the severity of the findings. So whether it's mild sleep apnea, moderate, or severe.
So remind me, that's like how many episodes of apnea they have over the course of the night or something? Right,
correct. So how many episodes of diminished breathing, temporary diminished breathing that they have per hour on average over the course of the night, which may be an obstructive apnea with very diminished breathing or a hypopnea.
Right. So obstructive apnea, like they can't get the air down their throat, or a central apnea, like their brain's not telling them to breathe.
And if the diaphragm's not moving at all and there's no movement on the respiratory, that would be considered a central sleep apnea episode.
Got it.
And this study can distinguish between obstructive sleep apnea and potentially provide insight into the probability of having another more complex sleep disorder,
right,
for which you may need further testing or a discussion with your sleep medicine physician.
Yeah. Great. I love this. I mean, seems very straightforward and easy to use. All right. So they have symptoms. We bring them in. They go home. They do this test. You read it, and you tell them that they have some level of sleep apnea. What are the choices for treatment?
The standard of care and first-line therapy for the most cases, vast majority of cases of sleep apnea, is the CPAP machine.
Did you bring one of those with you?
I did not.
Okay.
There are several brands, but they kind of do the same thing. They provide you with positive airway pressure that creates an air stent in the upper airway to allow you to breathe on your own easier, and that's called continuous positive airway pressure. That's the first-line therapy for the vast majority of cases of obstructive sleep apnea. And there's alternative therapy such as a dental device, like an oral appliance, that can help advance the mandible to provide more space for the back of the throat so that it's easier for air to get down.
So basically it sort of slides your jaw forward and then it's sort of propping everything open on its own?
So it moves the jaw forward, which provides a bigger space between the back of the tongue and the upper airway in the back.
And I know they're not both right for everyone, but for people for whom they're both an option, is there one that's easier to use, easier to get? I mean, how do you help people decide between those two things?
One of the biggest deciding factors for if you really need a CPAP as a treatment or not is the severity of the sleep apnea. So for mild to moderate cases, an oral appliance is considered an effective therapy for a lot of patients, more for milder cases. For moderate to severe or severe obstructive sleep apnea, a CPAP machine would be considered the better and first-line therapy. And that would be a deciding feature in the conversation as well.
Got it. And then I've been hearing some other things about a procedure that people can get. I know in the old days, people had surgery for sleep apnea. I don't think we do that much anymore.
Right.
Are there surgical options for?
There are still surgical options for sleep apnea to various degrees. Right now, a lot of patients may be seeing advertisements for Inspire, which is the clinical term for that is hypoglossal nerve stimulation. You can think of it as like a pacemaker for your tongue, for the back of the tongue. So there's an implanted device that's put into the chest wall, and there's a lead that goes to the tongue that stimulates the tongue and the muscles in the back of the throat to contract so that there's a space that forms to allow the air to go down. And that requires a thorough evaluation, meeting with a sleep surgeon, such as one of our otolaryngologists who specialize in sleep. And it's a potential second-line therapy for patients who tried CPAP, but it failed.
Interesting. How the procedure itself is not that complicated?
I would say that's a good question for the sleep surgeon.
Okay.
And there's risks and benefits that need to be discussed in detail prior to making that decision. But it does require workup and evaluation with the ENTs.
Yeah, got it. And what about all the stuff that you hear about on TV or whatever, like pillows or putting duct tape over your mouth or nasal strips and stuff? Does any of that stuff help at all?
So CPAP and oral appliance therapy has more data behind it for treating obstructive sleep apnea. There are positional devices that can help keep you on the side if a sleep study shows more definitively that your sleep apnea is really kind of more when you're supine or sleeping on your back. In that case, it may be part of the conversation to consider a positional device. So that's one of the options. Got it.
And I don't mean to bury the lead, but I guess losing weight is maybe the most important thing or a very important thing.
Absolutely. It's very strongly correlated. Obesity and obstructive sleep apnea, they have a very strong correlation. And just maintaining a healthy lifestyle, a general, very healthy kind of diet and exercise can help offset a lot of the stress that's related with having poor sleep quality and improve your sleep quality in general. So it's true that there's a strong correlation between being overweight or obese and having sleep disordered breathing, and optimizing that and seeing your family medicine physician for a close follow-up or your weight management specialist can really help with that.
So it might be that people lose weight and maybe they don't need as much other stuff.
Absolutely. There's a strong possibility if someone has gained a little bit of weight and they started to develop some snoring, there's a strong correlation there in terms of how they feel. It's very likely if they reverse that process, you're going to feel better again. And the snoring was probably going to go away. But you should always follow that closely to make sure that indeed things have improved.
Great.
Yeah.
Super helpful. I really appreciate your time with us tonight. I think before we wrap up, you wanted to mention some other sleep disorders that people should be thinking about as they're thinking about what might disrupt their sleep.
Absolutely. That's actually a very important thing to consider and a very good question. There are many different things that not only sleep disorders, but in general, that can disrupt the patient's routine, sleep schedule, from pain syndromes to depression. That should never be under the radar. It should always prompt an evaluation. There are sleep disorders that are also possible that are not sleep apnea that can cause someone's sleep to be not great, and they can cause them during the day to not feel very refreshed or to feel particularly sleepy. For example, someone can have restless leg syndrome, which can disrupt their ability to fall asleep. Someone can have insomnia, chronic insomnia. Someone can develop a periodic limb movement disorder where they move their limbs very frequently while they're sleeping. It causes them disruption, wakes them up, makes them feel unrefreshed, leads to daytime sleepiness. There can be REM behavior disorder, which is a condition with dream enactment. Sometimes this can be potentially injurious, and that should be evaluated thoroughly with a sleep medicine physician. And then during the day, you can have excessive sleepiness or something called hypersomnolence, where you require lots of hours of sleep, more than what's considered normal, 10 to 11 or more hours of sleep. These are conditions usually like narcolepsy or hypersomnia. They require an overnight test followed by a daytime study. And there are other things. I feel like a great place to start would be at the primary care office, the family medicine or internist, or even a pediatrician for the younger population, to see what's going on. Why do you feel unrefreshed or maybe tired? If you haven't had that evaluation, I think that's a great place to start.
Great. And that seems like a great place to end. Dr. Gilyadov, thanks so much for joining us. Thanks, everybody, for joining us. We'll see you next time.
Thank you, Dr. Weissman. It's a pleasure.